or Southwest Florida in Immokalee. And it has been a tremendous honor to nominate Dr. Jose Quero for this award, and we're thrilled that he was able to be the one to receive it here. I'm a pediatrician by training, and many years ago, when I started out in practice, I was in a small town called Milford, Pennsylvania. It's way up in the northeast corner of the state, right where New York, New Jersey, and Pennsylvania all come together. Milford has about 1,000 people, about 7 by 9 streets, and 1 stoplight. So I have a little bit of experience with rural healthcare myself. When my wife and I wanted to have a big night out on the town, we would go out to the big city, Wilkes-Barre. So I learned, being in a place like that while admittedly you have to give up a lot of things when you're in a rural area. You have to give up a lot of shopping opportunities, a lot of good dining opportunities, and ethnic food. It takes you a while to get around to any place. But on the other hand, you gain an awful lot as well. You get to figure out what's important in life. You get to know your neighbors, and the clerk at the grocery store, and the person at the counter at the deli. And most importantly, you get to feel like you're truly part and involved in a community, which is something that's becoming harder and harder to find in this country nowadays. So I think it takes a special kind of person to live in a rural area like that. And it also takes a special kind of doctor to want to practice in an area like that as well. Out in Immokalee where we are 45 minutes from the nearest emergency room. We have to provide a lot of the services for ourselves, otherwise our patients won't get them. So as a result, our system has set up a pharmacy, a laboratory, radiology, even our own bus system around town so that patients can access the services there. And the patients that we see, many of them are very poor. They come from different backgrounds. Many of them come from out of the country. They have a lot of struggles. They've had a lot of health challenges there. It creates a lot of difficulty in being able to get them the best sort of care. On the other hand, though, if you're patient and you're sincere and you take the time to get to know them, they will welcome you into their lives. And they no longer are patients. They're just people who have stories to tell, and you learn about their struggles and their history and everything that they go through in their day-to-day lives. They tell you their hopes, their dreams. They tell you about their families and what makes them happy and what really means a lot to them. And when you're in that setting and you do take that time, at the end of the day, you have the feeling that you've done a little bit of good for the world, and you've met a little bit of the need that's been out there. Dr. Jose Quero is exactly that sort of doctor. His students from FSU and from other centers who've come through, they praised him as being inspirational. And we've had patients who've come up to me and to him and to the rest of our staff and who've said they wouldn't be alive if it wasn't for him and because of his care. And I think most of all, he proves that healthcare in a rural area can be just as good as any place else, if not even better, I would say, because of all the hurdles and the challenges that you have to overcome in order to make sure that your patients are receiving good care and that you're attending to all aspects of their health and well-being. He sets a high bar for himself and for those around him and for the organization. And for that, I'm actually extremely thankful. I wouldn't have it any other way, because the focus of his care is ultimately what's going to be good for the patient. And at the end of the day, you have to be able to look them in the eye and know that you did the best for them and for helping them to get better. Dr. Quero is that sort of doctor. And that's why I'm thrilled that the Florida Rural Health Association has chosen to recognize and honor him for his years of service and dedication and inspiration for all of us who know and love him. And I believe that he truly embodies the promise and the rewards of rural health care in Florida and in the country. Dr. Jose Quero.
It's nice to have fans. I'm not sure I deserve it all, but this is really an honor and a pleasure to accept such a wonderful award, and I stand before you humbly and appreciative you have been considered for such an honor. I'm glad I'm not standing between you and lunch. I know that is a priority, and I will respect that. So if you want to resume meeting, please be able to continue. I feel a strong need to thank my parents who at a very early age instilled in me the value of hard work, education, and respecting each other. They did a wonderful job as an immigrant family fleeing the oppressive and repressive regime of the Cuban government under the Castro brothers. We survived many challenges, the immigration itself, learning the language. I remember walking the alleyways of the suburbs of Chicago with my father in search of some semi-decent, previously loved furniture that we could literally carry back to our apartment. My mother being ridden on my brother's bicycle to her first job at Rotary International. All this being done with pride and never wavering. My parents incessantly said, pursue your dreams, work hard, and get a good education, for we have been given a wonderful opportunity, and we should not squander it. And do not forget that whatever you learn, no one can take away from you. Unfortunately, neither one of my parents are still living, but I have this really strong mental image of my mother bursting with pride, running around heaven, telling God and everybody who will listen, that is my son, the doctor. And my father is saying, I think they already know that. No one in this room needs to be reminded that our work is challenging, difficult, stressful, and can be extremely frustrating. Yet it can also be immensely gratifying, and we can be proud of what we do and accomplish each and every day. Since a very early age, I felt, and probably no different than many of you, the need to make a difference and help others. I have dedicated my professional career to helping underserved but very deserving patients. And I can't help but feel this award validates my having succeeded to some extent. It is also most meaningful because I was nominated and selected by individuals who recognize firsthand the challenges of what we do every day. I hold this award very close to my heart. Previously, and many people don't know this, the other award which had meant so much to me was being selected Resident of the Year by my colleagues and faculty at Loyola University Medical Center, where I trained. The road here has been long and challenging. I could not have done it. Without my wonderful, hardworking, and caring staff at the specialty care department that I work on, and many of them are here supporting me. Again, great to have fans. We have overcome many obstacles. After many years of heated debates, we have finally begun to look at outcomes rather than just patient numbers in our community health centers. This is a wonderful change in paradigm, which will hopefully allow us more leeway in teaching our patients the skills required for them to deal with their particular disease, as well as allowing us to be more supportive. I could not have endured this journey by myself, and have been blessed to work with many wonderful people during my tenure at Collier Health Services, now Healthcare Network of Southwest Florida. Ms. Ellen Cordova is an outstanding nurse and leader who was a co-director of our HIV program with me, and we still see miracles in that program every week. Even though she and I could never agree on what temperature to set the damn thermostat. She kept us focused on what the correct path and has now moved on to become the director of nursing at our institution, where she continues to do excellent work. Mr. Richard Aiken, our ex-CEO, who with his suave demeanor and fox-like approach, one day made the following statement privately to me. He says, Pepe, we would like our best doctor to lead our HIV program, and we want you to do it. I said, really? I mean, how do you say no? We went on to develop that program into a model program, successfully treating hundreds of patients, teaching other care providers about HIV care, and surpassed many of the goals set before us, to the extent that in one of our audits, Dr. Corky Steinhardt, who was a very well-known HIV provider, made the statement, It is impressive that our institution was able to provide world-class health care in such a rural setting. This took hard work, commitment, and above all, the proper funding so we could have the proper staffing and medications to treat our patients. It is my hope that someday all care for adults can parallel the successes that we have achieved in HIV care. I also recognize and appreciate the efforts of our financial team and our CFO, Ms. Sandy Steele, who somehow and at times miraculously keeps the budget in the black. I know counting services and widgets is not easy, and budgeting for them is even more difficult. Our new leadership team, Mr. Mike Ellis, our CEO, Dr. Patasic, who's here, who is also the chief of psychology, and believe me, her therapy sessions at times are a must in order to survive. And especially Dr. Scott Needle, who just introduced me, who often gets to hear me rant and rave. I thank all of you for having the faith in my abilities and trusting me to get the job done. I also suspect each of you had something to do with my getting this award, and for that I appreciate it. And lastly, I thank my spouse, Bernie. She's been right up here, and I'm going to be on Facebook pretty soon. She's the one that holds my hand and keeps me smiling when things get hard, maintains me on solid ground, and does a wonderful job at keeping my ego inflated at the right level. Thanks for loving me so much and taking such wonderful care of me. And I think with this we can go to the next fellow. Thank you very much.